Assalamualaikum and hello everyone. Welcome to Garden of Health, where we dive in the fascinating world of veterinary medicine and its crucial role in preventing zoonotic diseases. Now, when we think of veterinarian, we often picture them treating our beloved pets. But did you know that they are also on the front liners of global health? From pandemics to food safety, veterinarians play a vital role in protecting both animal and humans. Joining us today, we have 5 incredible experts who will shed light on different aspects of this important topic. So let's get started.
Alright, for the first question, I would like to ask Dr. Alisha. Alright, Dr. Alisha, what is actually rabies?
To answer your question, so basically rabies is a non-invasive viral disease, which means it causes inflammation in the brains, and is usually fatal on a global scale. There are around 60,000 deaths from rabies each year, with 95% of human deaths occurring in Asia and Africa. Now, this number is likely to be a gross underestimate due to under-reporting. So, as well as likely too much higher. So, rabies primarily affects mammals, which are warm-blooded with fur, and technically any mammals can get rabies, and that includes people. Birds, snake, and fish are not mammals, so they cannot get rabies.
Oh, I got it. Alright. Okay, for the next question, as an ordinary person, how can we know that our pet or animal surrounding us having a rabies?
Okay. You cannot tell if an animal has rabies by just looking at it. The only way to know for sure if an animal has rabies is to perform testing in the lab. But possible clues might include like general sickness, problem swallowing, excessive draw of saliva, an animal that is overly aggressive, an animal that bites at imaginary objects, avoid animal that happens tamer than you would normally expect, and also an animal that is having trouble moving or might even be paralyzed. For example, a bat that is on the ground.
I would like to ask, what do you mean by the bat on the ground?
For the bat on the ground, if you see a bat on the ground, you cannot just touch it like this. Not don't touch it, cause bat one of animal that might have rabies.
Okay, I see.
Wow, that's kind of wonderful share from Dr. Alisha. And let's move to our next guest.
Alright, next we move to Dr. Melly. Dr. Melly, how we want to prevent this disease?
So for the government roles, we need to have the mass vaccination programs, which is research by Chevrolet et al. In Lancet Infection Disease shows that vaccinating at least 70% of dog population can effectively interrupt rabies transmission. So this highlights the importance of national vaccination campaigns in control and eventually eliminate rabies. Next is public awareness campaigns. So a study by Hampson et al. 2015 found that community education on rabies transmission and post-exposure treatment significantly reduced fatalities, and government should invest in public awareness programs to ensure that citizens understand how to prevent and respond to the rabies exposure.
So how about individuals?
So while government provide the necessary framework, so we as individuals can also play a crucial role to prevent the disease. The first one is we need to vaccine our pets. So the American Veterinary Medical Association recommends that keeping dogs and cats up to date on the rabies vaccination as the most effective preventive measure. So next is avoid contact with stray or wild animals. If you've seen any animals acting aggressively or abnormally, report it to the local authorities rather than approaching it. The last one is know what to do if we are bitten by the stray cats or dogs. According to the World Health Organization, 2023, immediate action is critical. So we need to wash our hands with soap at least for 15 minutes. So by working together, governments, veterinarians, and citizens, we can eliminate rabies as a global health threat. The WHO has said that achieving zero human rabies deaths in 2030 through a combination of vaccination, education, and rapid response effect. So that's all.
Dr. Shifa, I would like to ask you how to prevent this disease on stray animals.
So I'm very excited to discuss this because spaying and neutering programs are key to controlling stray animal population and reduce rabies cases. Overpopulation makes it very difficult to monitor, vaccinate and care for stray, which will increase the number of unvaccinated animals at risk of spreading the virus.
How does sterilization work to prevent this disease?
Okay, so basically, when stray dogs continue to reproduce unchecked, their number can grow rapidly, making it almost impossible to vaccinate all of them. But by spaying and neutering them, we can control their population, ensure fewer unvaccinated animals are roaming around the street. This makes vaccination program more effective and easier to manage. Additionally, sterilized dogs are often less aggressive and less likely to roam, which reduces the risk of bites that can spread rabies. It is human and sustainable solution to keep both animal and human communities safer.
So any final thought?
Okay, so I guess yes, spaying and neutering are just not about population control. They are crucial part of rabies prevention. Fewer stray mean better vaccination coverage, less risk of disease transmission, and safer community for both animal and people. If we all play our role, we can make a big difference.
Alright, thank you Dr. Shifa for the information. So now let's move to the next question, which is for Dr. Shafia.
Thank you. I'm glad to be here. I want to talk more about vaccination and research. So, rabies is 100% preventable, yet it is still claims lives every year. As a veterinarians, we focus on two key areas to fight this disease: vaccination and research. First, vaccination is the most effective way to stop rabies. Our job is to ensure that pets, strays, and even wild animals receive proper immunization. In many countries, vaccination at least 70% of the dog population creates herd immunity, drastically reducing the spread of rabies. We also educate pet owners on the importance of keeping their pets' vaccination up to date. Beyond vaccination, research is essential in improving rabies prevention. Veterinarians work closely with scientists to develop more effective vaccines, improve diagnostic tests, and study how rabies spreads. This research helps us understand which areas are most at risk and how to design better control programs.
So, do you have collab with others organization?
Yes, we also collaborate with public health officials and medical professionals in one health approach, recognizing that human, animal, and environmental health are all connected. By working together, we can track rabies cases that can improve treatment strategies and spread awareness in communities. Thank you.
Alright, thank you Dr. Shafia. So now we know that rabies isn't just an animal health issue, but also a serious public concern that requires a strong policies and coordinated action. So, Dr. Nasreen, I would like to ask, how do global and national health policies contribute to rabies control?
WHO 2021 to 2030 roadmap aims to eliminate human deaths from dog-mediated rabies by 2030. To achieve this, several key strategies are in place. First of all, expanding access to rabies vaccine. WHO, in collaboration with Gavi, the Vaccine Alliance, is ensuring better access to human rabies vaccine, especially in high-risk areas. This help protect vulnerable communication from fatal rabies infection. Second, providing technical guidance to countries. Strong surveillance system help detect and control outbreak yearly. Third, strengthening the One Health approach. The approach integrates human, animal, and environmental health sector to combat rabies more effectively. By using rabies elimination program as a platform for multi-sector collaboration, public health efforts become more comprehensive and impactful. Fourth, United Against Rabies (UAR) Multi-Stakeholder Forum. The initiative launched with WHO, FAO, and WOAH promote investment and collective action in rabies control. Global collaboration is crucial to securing long-term funding and sustaining rabies prevention efforts.
Okay, so how about our country? What they do?
In Malaysia, the Ministry of Health (KKM) plays a critical role in rabies prevention and control. Some key efforts include post-exposure prophylaxis (PEP) availability. KKM ensure that rabies vaccine and immunoglobulin are accessible in hospital and clinics, especially in high-risk regions. Immediate treatment after exposure is crucial in preventing the virus from reaching the brain.
Wow, that's very good insight. Thank you, Dr. Nas, for the sharing, and all of doctors.
Wow, we have covered so much for today, from civilians to food safety, wildlife protection, and policies. It showed that veterinarians do much more than we realize. Before we wrap up, let's thank to all of our lovely doctors for your sharing and your appetizers. Until we meet